Okay. Okay. So for, I think I've met almost everyone in here. I just met, is it Kate? Is that correct? Kelly. So sorry. Kate. And then what was your name?
My name is Jessica.
Jessica, nice to meet you. I'm a physical therapy student from downstairs. I just want to talk to you guys about working with the transgender and gender diverse populations, but I wanted to make sure that we include physical, occupational, and speech, since that's what everybody does in this clinic. If you guys want, I've got a handout and then a post survey. You don't need to write your name on it or anything like that. Okay, so let's just dive in. I'm Madison Haley, my pronouns are she, her. Just a table of contents. Okay, so let's go over some general definitions. This is basically just skimming the surface of the basics of working with these different populations. So let's get some basic definitions out of the way. Transgender, that's being a person whose gender identity differs from the sex the person had or was identified having as at birth. Cisgender, so I'm considered cisgender because I'm a person whose gender identity corresponds with the sex the person has or was identified as having at birth. So most people generally, if you're born male and you identify as male, you're cisgender. Sex, so this is either the two major forms of individuals that occur in many species, distinguished respectively as female or male on the basis of the reproductive organs and structures. And here in just a second, we're going to talk about where that kind of isn't black and white as we thought it was. Guys, stop me if you have any questions about anything at all. I'm happy to answer. Gender identity, so that's the internal sense of being male, female, some combination of male or female, or neither. So does anyone have, can you think of an example of someone that is it's not male or female, but they have a combination of either male or female or identified neither or some other type of gender? So like two-spirit. Has anyone heard of that?
Two-spirit?
Yeah, two-spirit. So in Native American or indigenous cultures, there's, in most of them, they have about 8 different genders in most of the tribes that we recognize here. Two-spirit is where they feel that they have female and male spirits within them, so they identify as a two-spirit person. Another gender identity other than male or female, so non-binary, so that's someone that identifies as neither. Or gender fluid, that's someone that sometimes they feel that their internal sense is female, sometimes it's male, different things like that. Okay, someone that's intersex. First, I want to start by saying someone that is intersex is not transgender, and someone that is transgender is not intersex. They don't mean the same thing. So someone that's intersex, that's a combination of your chromosomes, your hormones, internal sex organs, gonads, genitals that differ from 1 and 2 expected patterns. So generally, someone's sex is male or female whenever they're born. The doctor will say, hey, this is what they are, that. But you can have someone that's intersex, so you can be any combination of those things, including a male mapped or a female mapped brain. So about 15 years ago, we started doing a lot of brain mapping, and we found typical cisgender females have a certain map that their brain kind of goes by, and it differs from a male mapped brain. So you can be any combination of any of those things. So you can have female mapped brain, female hormones, female genitals, female chromosomes, but you may have sex organs might be different. They might appear male. That's an intersex person. Or someone can have internal organs, so like you can have a male that is born with a uterus. That's an intersex person. What is so, I will talk about it more in just a second. What's so interesting about that is it's more common than you would think it is to be intersex. It's about 1 to 2 in every 100 people across the world, and that statistic sticks in the US as well. And most people don't find out that they're intersex until it's an accident. So they'll find out, hey, I need to get some imaging around my stomach. I didn't realize I have a uterus. So you've had someone that's been male their whole life. All of a sudden, they get this imaging and they're like, oh my goodness, I didn't know that. Or they get some testing done and something comes up. The general definition for gender diverse. So that is describing members of many global and varied communities with gender identities and expressions differing from the gender socially attributed to sex assigned at birth. So that can be someone that's two-spirit, someone that is transgender, someone that identifies as non-binary, and things like that. Does all of that make sense to you guys? This is a lot of information I'm throwing at you, so feel free to stop me if it doesn't make sense. So let's talk about population statistics. This is going to include statistics on people that are transgender and then people that are just in the general LGBT community. So 2% of people in the US that are 13 years or older identify as transgender, which doesn't sound like a lot, but that's more than 1.6 million people. That's a lot of people. This statistic, so 41% of people that identify as transgender, 13 and older, have had at least one suicide attempt in their life. That's insane. That's huge. And then 70%, I think that this one corresponds to just the LGBT community, 70% report facing healthcare discrimination. That's a lot. 60% have been refused medical care. This is based on transgender patients. Have been just flat out refused care. Either their doctor doesn't agree with them, they feel like this is not a group of people that they respect, or they just don't understand. Or this can be someone that says, I feel like I don't understand the transgender person, like the things that come with it, where they are in their transition enough to treat you, so I'm just not going to treat you. And 28%, this is the LGBT community, just postpone medical care for fear of disrespect or harassment. I do this. This is super common. I do this. I'm cisgender, but I'm a lesbian and I present more masculine looking. I postpone medical care pretty often, or before I go to a medical provider, I heavily research them, because I've had issues where they just don't understand differences, just small differences, or they just get overwhelmed and they feel like they can't treat me. I've got 2 friends right now who are trying to do IVF, and they're going to someone that's in Little Rock. He's just got a reputation as like the best in the state, but he's also known for being wildly homophobic. And my friend, their wife is female presenting, and then my friend, they're non-binary, and the doctor will not talk to her, won't look at her, won't make eye contact, ignores her entirely in the room. So this is still happening today, and in Little Rock and very metropolitan areas. I know that we're in the South, like, we don't have the best reputation with working with these populations, unfortunately, but that's pretty crazy. This guy still has a reputation as one of the best in the state, but we allow him to be wildly homophobic. It's insane. And like I said before, 1 to 2% of the population in the world is intersex. So let's talk about our statistics. These really shocked me. I didn't expect them to be great, but some of these really shocked me. So PTs and PTAs, they did a study, and 85% that they reported that they tolerate LGBT patients. So I was like, okay, this is better than I expected. And then I got to this statistic where it said only 1% report full respect. That's wild. I didn't know that you could just have different levels of respect for a person and how they identify or how they look or what religion they are. That's crazy. Nurses are a little bit better, but these are still daunting. 40% report some respect, which just feels like full disrespect. And then 44% report full respect. And then general, so this study was with physicians, PTs, OTs, speech, nurses. These are all from the same study here, except for this last one, education. 68%, very low to average knowledge related to treating transgender and LGBT patients. That I kind of expected, and I do see that fairly often. I've met clinicians that feel like, man, I just feel like I'm gonna offend them, and I don't wanna upset them, I don't wanna make this worse. That's something that I can understand. Plus side is, we've got all this at our fingertips. I'm gonna give you guys some resources you can pull up just super quick, say, hey, I don't know what this definition means. My patient said that they're doing this and I don't understand why. I can just look it up. And then education, so on average in medical school, all of medical school, they only give 5 hours of education on the LGBT community, which means that there's even less education on just transgender patients. So for your entire stint in medical school, which is several years, you maybe get, let's just be generous and say 2.5 hours. That's crazy. I think that there should be a little bit more. And I think that that's leading to some misunderstandings or fear of working with these patients because you don't understand them, you don't want to upset them. And then generally not understanding the population can lead to misunderstandings and disrespecting them, as we've seen it right here. Okay, let's talk about our laws and policies. This is just Arkansas. This is from a source, it's called Movement Advancement Project. So they create a map of the US and all of its territories, and you can look at just your states. You can just click on Arkansas and you can see all laws that are related to transgender care, discrimination laws, and then LGBT and stuff like that. So these are just some laws that I pulled up on youth. So we're one of only 3 states that bans or restricts best practice medical care for transgender youth. So we literally said, please don't give your transgender patient who's under 18 best medical care. Don't do it. That's wild. I feel like, so this goes across PTs, OTs, this goes for physicians, nurses, everyone. Please don't do it. Don't give them the best medical care. Just don't kill them. Pretty much is it. That's crazy. We're one of 21 states that still allows conversion therapy. Have you guys all heard of conversion therapy? So conversion therapy, typically it's like a conversion camp, and you send your kid there, or I think adults can go as well, but it's typically parents sending their kids. And if their kid comes out and says, hey, I think I'm gay, or I think I'm transgender, or part of the LGBT community or anything like that, you can send them to this camp, and it's a religion-based camp where they try to convert them into cisgender heterosexual beings.
So it's the pray to get away.
Yeah, it's the pray to
Yes.
get.
But there's a movie called But I'm a Cheerleader.
Yeah. I wasn't gonna bring it up, but that movie's
It's great.
It's great. It's got RuPaul in it, who's always funny. And it's a satire, but it's pretty accurate to the way that you're treated in those camps. It's not good. It's abusive, mentally, emotionally. They're not good. So we allow that. We still let you do that. So are 21 other states. We're one of 18 states that bans transgender youth from participating in sports consistent with their gender identity. And I think a lot of that has to do with our lack of understanding of what that process is. Does anyone here happen to know what the process is? Say if I felt like, hey, I think I'm transgender, like I think I want to transition to being male. Do y'all know what the steps are to start to transition legally? Okay, so the steps are you have to have two mental health professionals clear you. So you have to go to therapy for several months, speak with them, and they say, hey, we both agree, I'm not being biased because I've got another person, that this person, they want to transition, and I feel like this is right for them, this is accurate, they're safe, this isn't anything else that's going on. And that's just before you're allowed to get hormone therapy. So you can't just step in and say, hey, I just want some hormones, I want to transition, give me some testosterone. You can't do that. It's not legal. Nobody allows you to do that. You also have to meet with an endocrinologist. They're going to be the one that gives you the hormones and assesses what hormones are going to work best with you and things like that. It's not easy. So then if you want to play sports, you not only have to go through that process, you have to have been consistently on those hormones for at least 6 months, which isn't just a coincidence. We didn't pull 6 months out of our butt. Like there's a reason. So we choose 6 months because it's 6 months of you consistently being on estrogen or testosterone, your body now acts like that gender. So if I started taking testosterone in 6 months, I have the same health risks that men have. So my risk for health disease would be the equivalent of a male's risk for heart disease. Now there's other things that come into play like breast cancer. Those things are going to be a little bit different. We know that men can get breast cancer, but women are more likely. My chance for breast cancer is still a little bit higher. But everything else biologically, your body reacts the same way that a male's does. You're not gonna be able to keep the same muscle tone. Your body's not gonna let you. If you want to keep that same muscle tone, you have to work out triple the amount. It just doesn't work. So there's a reason that it is that way. But I think most people that put these laws into place, they just don't understand. They're not looking at it. They don't know. And so all they see is, I'm not gonna let my son play on this, and they just don't understand. So laws that just pertain to anyone, so these are adults as well. We're the only state that explicitly permits insurance to refuse to cover gender affirming care. No other state does this, no other territory does this, it's just us. We're one of 15 states that explicitly excludes gender affirming care for its state employee health benefits. So anyone that works for the U of A, anyone that works for the state hospital, UAMS, things like that, you're not allowed to get any gender affirming care at all. It's not gonna be covered. You can get it, it's not gonna be covered under your insurance at all. And I think what's important to remember about this is these things save lives. I think that it's been pretty heavily publicized how much it can change the mental health of someone that gets their gender affirming care. We've seen that suicide rates go down, mental health improves just by allowing gender affirming care. This isn't, some crazy story. It's not, I want veneers and I need my insurance to pay for it just because I want my teeth to look a different way. It's not, this isn't the same thing. There's some others on there. I'll send you guys this, but I'm not gonna read everyone to you out loud because it's a lot. We're one of 16 states that does not prohibit discrimination against public employees based on sexual orientation or gender. So if I apply to work at UAMS, you guys, for the state law, are allowed to discriminate and say, I don't want a lesbian working in my clinic. No, you're allowed to do that. It's totally legal. Now, where this gets a little bit hairy is our federal laws. And so that was kind of hard for me to understand. So there can be a federal law there's federal laws that say you can't do that. But then if your state law doesn't cover it, then you can get stuck in this limbo where, okay, well, federal law only covers it if it's this, this, and this situation, or if this was said this exact way. And a lot of times people rely on their state law to back them up and say, okay, they also cover this. But if I get stuck in that limbo, it gets really hairy, it's really tricky, and so it allows people to get away with that a lot easier. We're one of 35 states that allows a gay trans panic defense. Have you guys ever heard of that? Okay. This is really scary, and this is especially scary because I've seen people that, like, I've had as friends on Facebook, I've seen them say this. So people like coworkers that I maybe worked with. A lot of you guys know I've worked like in bars and restaurants, so all kinds of people in there. So this allows someone to say, I beat this person up because I didn't realize that they were gay. I didn't realize that they were transgender, so I beat them up. It freaked me out. It's legal to use that defense here in this state in 35 states. And shockingly, it's been used. Recently, I'm trying to think, it was about a year ago. There was a pretty big case, I can't remember which one it was, but it was used. And it was legal in that state.
I don't understand.
So what happened in that case and what I've seen happen is so you're on Tinder, you're dating, and you go on a date with this person, and from what you understand, this person is female, they're born female, they're cisgender, that's what you understand this person to be as. You go on the date with them and you find out later, they say, hey, I'm transgender, I've transitioned, or I'm bisexual, or both, I'm bisexual and I'm transgender, and you freak out on them. So we allow the defense for you to say, that freaked me out so much that I just beat the crap out of them, I just beat them up. It freaked me out.
That's legal?
Yeah.
Seriously?
It's legal to use it.
As a defense?
As a defense. And sometimes it works. I've seen it work, it's crazy, it's ridiculous, it doesn't work just, all the time or anything, and a lot of times they're like, that's wild, please stop doing that, but I've seen it work recently. It's crazy. So here's some actions and services, so some things that we can all do. So the biggest one, I say that this is the easiest, but my only concern about changing this is using inclusive paperwork, is if you have to go through a legal department. So with UAMS, you may have to say, hey, I want to change my intake form. Do I need to go through the legal department? And they'll probably say yes. Likely it's not going to be a huge issue, but we all know that the legal department, for like one small change, it can take you 6 months. It's annoying. But on these inclusive pieces of paperwork, so it's important to ask, these are important because these let your patient know that you're a safe and inclusive place. Like, you're taking actions to say, hey, like, if this is what you are, then that's fine. Like, I'm open to it. I know what that means. You're going to be safe here. We acknowledge those people as people, rather than not listening to them and saying, that's not a real person, or I don't respect those people. Making sure that you ask their preferred name and pronouns. Even just, I've met people, their first name is John, but their middle name is Gary, and they go by Gary. Yeah, I need to know your legal name so I can process your insurance and things like that, if your legal name has not been changed yet. But asking your preferred name is helpful for all patients, not just transgender and gender diverse patients. Asking their sex assigned at birth, and then their gender identity, including transgender man, woman, or genderqueer. But making sure that you also put a decline to state or prefer not to say section. Some people don't want to out themselves because they fear that may change their care, or it may freak their therapist out. They don't know what that means. Do I need to change something like that? And that's perfectly fine. But if I'm working with someone that has had a certain surgery or is on certain hormones, sometimes that can change health outcomes. Okay, so let's talk about some of the services we can provide as PT, OT, and speech. So for physical and occupational therapy, we can do pre and post top surgery care. So for pre-top surgery, top surgery is either breast augmentation, which I didn't put pictures of here. I didn't want to put pictures of breast tissue, not knowing if there's going to be patients in here or not. Or you can do chest masculinization, which is what these are 2 pictures of here. This top one right here, this is an approach called inverted T. It's used for whenever there's more breast tissue that they need to remove, they need to get more space in there. And this bottom one is the buttonhole approach. I don't see any scars. That's 10 months post-op, 0 scars there. And then this top picture is also a good example of it's not healing well. There might be an infection, like they're gonna have a lot of scars. But pre-surgery, PT and OT, we can help work on those chest muscles. You need to get those as strong as possible because, as we know, 6 weeks after surgery, it's like a mastectomy. You can't lift those things. You're not gonna be able to use this. We need those as strong as possible. Pelvic floor therapy. So general pelvic dysfunction. These are all people who still have a pelvic floor. Men and women have pelvic floors. Intersex people have pelvic floors. We can always work with all of these people anyways with any general issue. People that are gender diverse in any way, they can still hurt their rotator cuff. They can still, sprain an ankle. They can still break a bone, all those things. These are just things on top of it. So pre and post surgical care, so there's different surgeries for like bottom surgery, so genital surgeries that some people opt for. It's important to know too that your transgender patients don't always opt to do what some people consider a full transition. So they may do a top surgery, not a bottom surgery, or bottom surgery, not a top surgery. You see all kinds of different things. It's a spectrum, and there's no final transition. It's whatever that person determines, like, hey, I'm comfortable being this way, this is how I want to be, this is my final transition. And then scar management. So this is going to need some scar management. This still might need some scar management, even though we don't see a blatant scar anywhere. They may have some things underneath, because that's an invasive surgery. Scar management is also important to remember too. So with like vaginoplasty and phalloplasties, a lot of times they need a skin graft from either your thighs, your arm, or your stomach. So you're gonna have a lot of scars with skin grafting, both at the site and like wherever they took it from and wherever it's at. Speech therapy. So I didn't realize this until a year ago. Speech therapists have the option to become more specialized in voice feminization and masculinization. I didn't know that. It's a very it is. It's very niche. You can get specialized in this or take some classes on it. This isn't something that I think all speech therapists do. Speech therapists correct me.
Didn't know.
Yeah, did you guys know? You didn't know.
I mean, it makes sense, but I guess it's just not one of those.
Yeah. It's a pretty complex science too, because it's not just like, hey, just speak in a higher voice, or hey, speak in a lower voice. There's a huge science to it. I got down a whole rabbit hole with this. So what do we do with all this information to help you become an advocate? Just advocating for these patients, that's going to help improve mental health, wellness, your skill as a clinician, everything. So in your clinic, so ask for that inclusive paperwork. Ensure your patient is using ensuring you're using correct patient pronouns. So that includes if your patient leaves, and I'm talking to Vito, and he accidentally uses a pronoun that my patient doesn't use, say, hey, did you mean she, or did you mean he, or they, whatever they use instead? Because it's important to do that while they're not around, because I feel like that's not respecting that person as a person if you're not doing it while they're not around. And we get it, things happen, it's a quick thing, like even if you do it with your patient, they identify as he, but you say she, you say, oh sorry, he, just real quick, fix it, they understand. Support your trans patients. So if they're open about their transition with you, don't out your patient if your patient hasn't said, hey, I'm transitioning or I have transitioned. Don't do that to your patient. That's just not cool. They may feel like, hey, I'm cis passing, which means I look like the gender that I want to look like, but I was not born that way. So just and then if they are open to you, ask if they're in need of other trans-friendly providers. So this is a big one, especially here in Arkansas. It's hard to find providers that are trans-friendly. Either that they're educated on treating those patients or that they provide services that are gender affirming. Educate your others, your coworkers, your friends, your family, your patients if the subject comes up, but I understand that that can turn into a whole wide conversation of like politics and beliefs and religion. I'm not saying go up to every patient and be like, have you heard about the transgender? That's probably not a good idea. But if they have questions about it, something that just comes up. I feel like that's happened to me a lot. Maybe it's because I look more masculine, but it gets brought up with me a lot. And so I'll just have a conversation with them, and my patient can believe whatever they want to believe. That's okay. Establish local providers. So start putting together a list of local endocrinologists, mental health providers. I know for my last presentation with you guys, I gave y'all a list that was made by Faith Yam, and it's an Excel sheet that has a bunch of local providers, what insurances they take and what they specialize in. And there's quite a few on there that specifically say that they treat and work with LGBT patients and they've been trained in working with those patients. So that's a good option too. Plastic surgeons. Dr. Kalam is here. He's the only guy that I found in this area of the state that does top surgery. So he does breast augmentation, feminization. Most people leave the state. And I've got a couple providers here for you guys to start. So here's some resources. The World Professional Association for Transgender Health, WPATH. They're known all across the world. They're pretty much the top people to go to look up information on how to work with your LGBT patients, but especially your trans patients. They've made something called, it's the SOC 8, so it's the standard of care. They're on the version 8. And it doesn't specifically mention any of the therapies, but it gives you a general, this is what your intake form should look like. This is how you can address your patient to help make things not awkward or make sure that you're using the right pronouns and you're not offending them. It's really awesome. The LGBTQ Competency Handbook for Physical Therapy was actually made by PT Proud. And I got to see these guys speak over at the combined section meeting last year in San Antonio. They're really cool, but they've made a literal handbook for physical therapists. And there's not much that is super specific to physical therapy on it. It's great for all therapies. I would use it for occupational and speech as well. The Transgender Law Center, they're helpful for a lot of reasons, but they work directly with the Movement Advancement Project that I was talking about earlier. That's the MAP. This is a great place to see. So these laws are changing all the time. All the statistics that I gave you, they've been updated since October 25th of this year. So they stay on it because these things are changing so quickly. So it gives you a good idea, like, can my patient adopt? Can I adopt in this state? Things like that. And then are there non-discrimination issues? Things like that. Vector Health, so me and Vito were talking about this. I've got a couple cards here. They're on Steamboat Drive, so you know where JJ's is over off of Weddington. They're like right next to them. Vector Health is Dr. Stephanie Ho, and her APRN is Michelle Green. They specifically do sexual and reproductive health, gender transition services, and primary care. And I believe that they also have mental health services there. I've reached out to them before to ask about like local, I've been starting to try to build a list of local plastic surgeons and things like that and ask their opinion about different surgeons and things like that for my patients. And they're just wonderful. They're super great. They were like, hey, if you find more, send us those. And if we find more, we'll just send them to you. They're so happy to work with anyone that wants to work with them. We've also got, so PT Proud that I talked about, they made this right here. They're a part of the APTA. And then we also all have the APTA, ASHA, and then AOTA. Do you guys shorten it that way? AOTA, occupational?
Yeah, AOTA.
We all know that if you're a member of that, so there's some things that are public, but if you're a member of it, you can also get more information on current research. So that's always helpful. And I just think it's really important for us to remember that educating ourselves on how to work with these patients is only going to make you a more skillful clinician. If you can work with diverse populations, you can work with any population. And this is going to improve your patient's care, your patient's life, their mental health, everything. So this is just a buttload of research that I did. But do you guys have questions? That was a lot of information. I'm happy to dive into any more of this. Feel free to email me, anything like that. This is what I love to do. My goal is to work in pelvic health and work specifically with transgender and intersex patients and LGBT patients in general. It's like, this is what I want to do. If you ask me a question I don't know the answer to, I need to know it anyway, so I'm just going to research it. And please don't think that I'm an expert on this. I'm not transgender. I'm lesbian, so I'm a part of the LGBTQ community. That doesn't make me an expert on this, so feel free to ask me questions. Everything is different for everyone.
Can you send me Faith's list again?
Yeah, I'll send that to you guys again.
It's in the T drive, but
Oh,
you
it
have
is.
so much in the T drive, sometimes it's hard to find things
Yeah,
in the T drive.
it's a lot. I'll send y'all the presentation too.
Yeah,
and
that'd be great.
this other information. I'm gonna leave a couple of these cards for Vector. If you have patients that ever ask you a question about, hey, I can't find a good just PCP, Dr. Stephanie Ho is great. She's fantastic. Cool.
So it's a physician and nurse practitioner over there?
Mhm.
Okay.
Yeah, and I think that they also have some mental health providers. They're just not directly listed on their card. They've got a website though that'll also show you things that they do. Here, I've probably got 9,000 tabs. Yep, pulled up.
RAM working hard. Computer.
You what?
Said your RAM's working hard.
It really is. I feel really bad for it. It's like 10 years old.
Tapped up.
I don't know how it's still alive. So here's some other providers that they have and what they do, but you can also look at the services they provide. So they've got primary care, all kinds of things. But if you click specifically, let's do LGBTQ health. That does not give me as much information as I thought it would. Let's talk about sexual and reproductive health. So this is a list of all the things that they provide there. And they also provide referrals. And so they're gonna make sure that whenever they refer your patient, they're referring to someone that's trans friendly or LGBTQ friendly. So you're not going to someone that is gonna ignore your problems or gaslight you and make you think, oh, it's not really happening, I'm being dramatic. So they're really nice over there. I like these guys a lot. But yeah, cool.
That was great.
Yeah,
Thanks,
thank
guys.
you.
Thank you very much.
Thank you. I've got a post survey. You don't have to write your name on it or anything, but feel free to write any notes that you have for me